Health Minister Dr Joe Pasha giving Nehawu members until this morning to go back to work or face consequences. That's after the Labour Appeals Court interdicted the strike and ordered the workers to return to their posts with immediate effect. Well, the Department of Health says it welcomes this ruling, saying patients' lives should come first. Now, the workers affiliated to Nehawu downed tools last week, demanding a 10% salary increase, while the state is offering 4.7%. Let's talk further now, and we're joined by the Deputy Health Minister, Dr Sibongiseni Dhlomo. Deputy Minister, thank you very much for your time. Let's begin with whether or not workers are back at their posts this morning.
Good morning, Xoli, and good morning to our viewers. I cannot be able to confirm, Xoli, because we are dealing with the countrywide activities, but there were spots that were focused on. You would recall, probably you may not be aware, that we never had any protest in Western Cape, little in Kailish, and we stopped very quickly, and there's nothing that happened in Limpopo. So we will be gathering the information. I do not have all the figures this morning. What the minister was doing last night was to actually say, in the event the leaders of Nehawu workers have not reached out to them, he is reaching out to them through the media brief that he had to say, while the court order was saying with immediate effect, we just want to say to our staff members, probably not immediately as 2 o'clock or 3 o'clock yesterday, but as of this morning, all of them should be at work and started. Hopefully we will be getting the information whether all those who were supposed to report for a 7 o'clock shift are there. And I do not have that information as I'm meeting you now, just an hour and a half after the shift has started. So we will be gathering the data during the day to confirm. But we just want to continue to advise them that it should better they go back, because there would also be consequences, as we have put it. I mean, really, if you ignore a court order, you are bordering on really transgressing on some misconduct issues. So we would advise them to take that responsibility and go back to work.
Yeah, Dr. Dhlomo, you and I have very little time because of the commitment that you have. Let's then talk practicalities. Consequences, what does that mean in practice? If a worker is not back at work today, in the morning, in their morning shift, what will happen?
Firstly, we have said to all managers in all facilities should firstly collate the information of who was there on the day 6, 7, and 8 of this month. Dr. Dhlomo, was he at work or not at work? And that also will kick in the no work, no pay principle. But secondly, those who then will be at work today will then be noted as being at work. But if you are not, you obviously be going through a process of a disciplinary process that might kick in for those that are not at work, because we now have something to hold on to, which is a court order that actually prescribes and actually instructs all of our workers to be better at work. If you then ignore that instruction through court, then we will then find it that within our own systems, those disciplinary processes will definitely kick in. That is why Minister was urging all our managers of all facilities to note and not be found wanting in terms of getting a proper register of who is and who is not at work today.
Yeah. Deputy Minister, as a politician, I know that you will always veer from using any strong language, and perhaps that's why you're not using the word fired if these workers are not going to return to work. However, an ordinary South African who has been trying to access a healthcare facility and could not do so because of workers who have gone on strike illegally, what are you telling those people, and I dare say the ones who have lost loved ones, and yet I know that you're going to say we have yet to make a direct link, a causal link between the deaths of those that have been announced by the minister, and what do you say to South Africans who have been prejudiced in this manner?
Well, it's never been seen before where people, because of their issues, will block an ambulance carrying somebody who's sick, who needs to be attended urgently, and that ambulance can't access either the community to pick up or an ambulance to drop someone in the hospital because they are blocked by rocks and burning tires. We haven't actually experienced a situation where people, because they are protesting, they go into ICUs and high care wards and removing staff members who have nothing to do with the strike but wanting to respect and the dignity and those who are in hospitals and support them. So really, those things, those clips are available, they'll be looked into, and the managers are going to assist, because that actually calls for a very serious disciplinary process. Of course, if you cannot defend yourself, why you had to go into a ward, drag someone out who's helping a sick patient, close to be, I don't know what will stop a dismissal in such an event, but that process must be followed, be respected, and be allowed to go through. It's a very unfortunate situation where, I mean, some of these leaders, they knew long time ago during apartheid, we had such situations, but nurses and doctors were protected because they may be the very same group of people who will support you when the police are brutalizing you on the streets. You will have to go to a clinic, a hospital, and get some support after the march and demonstrations. These days, nurses are being dragged out of hospitals when they are helping the sick ones. Ambulances are being blocked. No, that is not actually a civil society that can allow. There's no civil society that can allow such type of behavior.
Well, in the same breath, Deputy Minister, on the flip side of this conversation, these workers that are on strike, they're saying the very reason they have had to go on an illegal strike is because they are considered workers that are essential workers. Yet, they are not paid as essential workers. Instead, they have to watch you and fellow executive members, as the DA said yesterday, living like rock stars, and you're completely removed from the realities of what this country has to offer in terms of just how harsh the conditions have become.
Yeah, no, I would leave out that grandstanding behavior of the DA, but says that these were some of the issues that were agreed upon on the Labour Relations Act, to say there should be a group of South Africans who are public servants called providing the essential services. And therefore, I've always been vocal to say, let us probably work out such that those people should not be pushed into the streets because they are not getting what actually is deserving. However, these are issues that must be contained and continue to engage them through the bargaining councils. Of course, we are part of the mandating committee as well, but there is a leader there in the Department of Public Service and Administration. By the way, we have done an excellent job to really be able to support us with these court orders. But what you are saying, there should be negotiations and talks, and when people feel that they are really aggrieved, those talks should not break, but continue to engage and end up finding each other rather than to actually cause these problems that we do find. We do accept that they are essential workers, and also we acknowledge that they should probably be protected and not find themselves to be on the situation that they are at. However, those negotiations should continue and not being taken the way they have been taken out of the negotiation table of bargaining council. Very
briefly, I know I need to let you go. You speak about a mandating council. What council is that, and who constitutes that council, and is that mandating council meeting at least today?
Yeah, it's a mandating committee of which I'm saying the Department of Health is part of. It is led in our government by the Minister of Public Service and Administration. The acting minister, Babunez, has done a good job there. He has handed over to Minister Kivit, who is now continuing his. Health being one of the biggest and largest employer within the government, he is also a member of that mandating committee. But the actual leader thereof is a Minister of the Public Service and Administration. We hope that in the discussions that are ensuing amongst the leaders of unions, they would find a space to really call upon the minister to continue to engage if there is space to do that, and probably go back to their spaces of work and continue to do this while the engagement are continuing within government with the trade unions.
Deputy Minister of Health, Dr. Sibongiseni Dhlomo, thank you very much for your time. All right.